Hello, welcome to Smile with Pediatrics. Today's topic is the small volume radial pulse. Palpating arterial pulses forms a basic component of routine medical examinations, and the radial pulse is usually the most commonly used one. This is because it is easily accessible. The radial artery is a muscular artery, and it is also one of the smaller arteries in the body with a diameter of less than 10 millimeters. Similar to the radial artery, the arteries that supply the deeper organ tissues are smaller arteries of similar caliber and muscle structure. Thus, the strength of the radial pulse provides a good possibility to extrapolate the adequacy of blood supply to the internal tissues. And why is this so important? The reason is that the metabolism at the tissue and cellular levels are the ultimate determinants of the outcome of most disease conditions, particularly hypoperfusion and shock. So since you can often very easily feel for small volume radial pulses, we can also roughly estimate internal organ perfusion and forestall adverse outcomes. However, for more accurate and detailed measurement of pulse characteristics, electronic equipment are available. Nonetheless, at the first point of contact with the patient, manual palpation is mostly the routine means of evaluating pulse characteristics in practice. Thus, a lot is hinged on the ability of the clinician to detect small volume pulses in children of all ages and sizes. In practical experience, there could be a lot of inter-observer variations in reporting pulse strength, and small volume pulses may be missed in the early stages of shock. Non-committal terms like moderate volume pulse, suboptimal pulse, etc. may be observed among clinicians, which however do not lead to clear action plans. These may have unpleasant consequences, as the point at which children progress to irreversible shock is often unpredictable. Here are some useful practical tips. To acquire a baseline knowledge of normal pulse strength in children of various ages, one may need to routinely feel the pulses of healthy children. This way, instinctively, one is often able to detect an abnormal pulse volume as soon as it is felt. In addition, as a simple guide, when one has to struggle to locate the radial pulse, the chances are that it may be of small volume. Furthermore, a setting for hypoperfusion should be looked for in the history, as well as signs of shock on examination, and prompt action should be instituted whenever poor perfusion is suspected. A stepwise summary of the suggested points are as follows. 1. Examine the radial pulse strength of every child in addition to the pulse rate. 2. Develop the skill of detecting abnormal pulse volume. 3. Whenever the radial pulse strength is reduced or difficult to feel, have a high index of suspicion for shock. 4. Place the child on monitors or other devices if they are available. 5. Promptly check for other features of shock in the history and physical examination, and examine the other peripheral pulses as well. And 6. Do not ignore telltale signs of shock and start treatment promptly. In conclusion, the strength of the radial pulse is an important clinical sign. It is easy to assess in almost all clinical settings and can make a huge impact on the critical decisions and treatment of sick children. Hence, attention should be paid to it. Thank you for joining us on Smile with Pediatrics, and you can kindly follow us on the link below.